How to treat nightmare disorder. If you're struggling with nightmares that are disrupting your sleep and daily life, you're not alone. Nightmare disorder is a real condition that affects many people, but there are effective ways to treat it. First, let's understand what nightmare disorder is. It's characterized by frequent, intense nightmares that often involve threats to your safety and well-being. These nightmares can leave you feeling anxious, sweaty, and with a racing heart, making it hard to fall back asleep. To treat nightmare disorder, several therapies and treatments are recommended. One of the most effective is image rehearsal therapy, or IRT. This involves rewriting the script of your nightmare to give it a less frightening or disturbing outcome. You work with a mental health professional to reimagine the nightmare and then practice this new version when you're awake. This can help your brain learn to replace the old, scary scenario with a new, more positive one. Another approach is exposure, relaxation, and rescripting therapy, ERRT. This therapy combines exposure to the fear or anxiety causing the nightmare with relaxation techniques and rescripting the nightmare. It helps you face your fears in a controlled way and change the narrative of your nightmares. Cognitive behavioral therapy, CBT, is also highly effective. CBT helps you identify and change negative thought patterns and behaviors that might be contributing to your nightmares. It can be tailored to address specific issues, such as PTSD or other psychiatric conditions that might be triggering your nightmares. In addition to these therapies, other methods like hypnosis, lucid dreaming therapy, and progressive deep muscle relaxation can be helpful. Hypnosis can help you enter a relaxed state where you can better manage stress and anxiety. Lucid dreaming therapy teaches you to become aware that you're dreaming, allowing you to change the course of the nightmare. Progressive deep muscle relaxation helps you relax your body and mind, reducing overall stress. Medications can also be part of the treatment plan. Prazosin, for example, is often prescribed to help reduce the frequency and intensity of nightmares, especially in people with PTSD. It's important to work with a healthcare provider to determine the best treatment plan for you. They will consider your individual circumstances, the severity of your nightmares, and any other health conditions you might have. Remember, treating nightmare disorder takes time and patience, but with the right therapies and support, you can improve the quality of your sleep and your overall well-being. Don't hesitate to seek help if you're struggling with nightmares. There are many effective treatments available.